Good morning, Dr. Anthony, and thank you for joining us today for another COVID-19 update. Minister, firstly, what is our current active cases and hospitalization numbers?
So active cases right now we have 649 cases, and over the last 24 hours we had 71 new cases. Hospitalization, we are now at 20 cases across the country, with 9 persons currently at Ocean View and 1 person in the ICU. We have testing facilities available across the country, and we would like to encourage more people to be tested. The unfortunate thing is that a lot of people now might have COVID, but they don't come forward to be tested. And that's unfortunate because they can continue to spread it to other persons, and that can be more challenging to manage. If persons have flu-like symptoms, they shouldn't assume that it's a flu. They should go and get tested to verify whether or not it's COVID. And if it's COVID, then they'll need to isolate at least for 5 days.
Minister, let's talk a little bit about long COVID. Can you say how these persons are recovering? What is the treatment, and how long does it take for them to get back to normal?
Well, long COVID, the symptoms vary. You know. So after someone would have had the acute phase of the infection, let's say they were hospitalized and discharged, some persons would continue to experience symptoms for long periods of time. In some cases, as much as a year, and in other cases, probably longer. And that's hence the name, long COVID, right? Because you continue to experience these symptoms. It doesn't mean that you're infectious, but you continue to have, let's say, some people, about 5% of these patients, in one of the recent studies that came out from the British Medical Journal, but 5% of these patients continue to have problems with smell and taste. And this continues for more than a year. So the symptoms, depending on what it is, can persist for long periods of time. The latest one that some of the studies are showing is that persons who have long COVID can experience problems with sex drive, can experience hair loss. So these are the symptoms they are still trying to unveil. In Guyana, we have set up teams of people who would normally see these patients depending on what symptoms we are seeing or what symptoms they're presenting with. And we continue to treat them symptomatically.